For everyone who pulled together from a distance. For everyone who stayed in and stayed out. To those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID. For everyone who pulled together from a distance. For everyone who stayed in and stayed out. To those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID. For everyone who pulled together from a distance. For everyone who stayed in and stayed out. To those who want to dance again, cheer again, hug again.
Thank you, everyone, for taking the time to join us today from the Legislative Building in Regina. We have Premier Scott Moe, Saskatchewan's Chief Medical Health Officer, Dr. Shahab, as well as SHA CEO Scott Livingstone. We'll start with opening remarks and then move to questions. Premier?
Well, thank you, Matt. Good afternoon, everyone, and thank you for joining us here today. Saskatchewan's vaccine rollout continues to lead the nation, and that is thanks to all of the hard work of our dedicated frontline staff, all of our frontline healthcare workers across this province. They have now delivered more than 184,000 shots. That is directly into the arms of Saskatchewan residents. That is a rate of over 15,600 per 100,000 of our population, the highest rate of any province in Canada. We are quickly moving through our most vulnerable residents, our seniors in our communities, and we are just about finished delivering both the first and the second doses to the residents in long-term care and personal care homes across Saskatchewan. Overall, more than 3/4 of people over the age of 80 and nearly half of Saskatchewan residents in their 70s have now received their first dose. Letters went out over the past few days to about 25,000 clinically extremely vulnerable individuals in the province, explaining precisely how they can book their appointments by phone. Thousands have already called in to book those appointments. Our vaccination rate has slowed down just a little bit this week as we wait for our next deliveries of Moderna as well as AstraZeneca to arrive, but it's going to pick up again, and it's going to pick up again very quickly. In fact, over the course of the next 2 weeks, we are expecting almost 180,000 doses to be delivered in Saskatchewan. And I said we have about 184,000 that have been delivered so far. That's nearly as many in the next 2 weeks as we have done thus far. So that means more appointments will be opening up, more drive-thrus will be opening up, more age groups will be opening up, and a lot more Saskatchewan people are going to be able to have the opportunity to receive a vaccine. Tomorrow, starting at 8 a.m., everyone in Saskatchewan aged 60 and over can book their appointment online or they can call by telephone. 60 and over. That's down 2 more years from where we are currently at 62 years. So that's thousands of more Saskatchewan residents who can book their first shot starting at 8 a.m. tomorrow morning. I want to thank everyone who has made an appointment already and who has already gotten their shot in many cases. And I want to thank everyone else who is patiently waiting their turn. We're going to get to you just as quickly as we can, and because for all of us, the most important thing that we can do to protect not only ourselves but those around us is to get vaccinated. And that's why yesterday the government launched a new ad campaign asking everyone in Saskatchewan to stick it to COVID, to get vaccinated. And I think the ads are quite strong. I think they're actually great. The first one reminds us a lot about the things that we may have missed over the course of the past year, but things that we will be able to do again soon enough when we have the majority of Saskatchewan residents vaccinated. So in the coming days, you're going to see additional versions of the ad with messages from Saskatchewan people about why it's so important for each of us to consider getting vaccinated and why it's important for all of us to keep us all safe. So let's all do exactly what the ad says. When it's your turn, let's stick it to COVID and let's get vaccinated. In the meantime, until we all have a chance, until that day when we can get vaccinated, we need to all do our part. We need to all continue to follow the public health orders that are in place and the guidelines that are in place in our community. The current public health orders, as we have them, which were set to expire on April the 5th, are going to be extended until April the 12th. We all need to be very diligent in following these public health orders as they are put forward, so that we can continue to drive our case numbers down without increasing our restrictions further in our community, or extending the already increased restrictions that we have in the community of Regina. This is very important for all of us to be very diligent. I believe that we will be able to get our case numbers under control in the few communities where they're increasing without further restrictions, but we all need to do our part. We all need to follow the guidelines and the good practices that have been put forward. We need to be very diligent at this point in time in following them to a T each and every day so that we can hinder the spread of COVID-19. Finally, I just want to quickly mention that the spring sitting of the Legislative Assembly will begin next week. I want to thank both the government and the opposition House leaders for all of the work that they've been doing behind the scenes to ensure that session is able to move forward safely. The spring sitting is going to look an awful lot like the fall sitting, with members physically distanced like we were in the fall. About half of the MLAs will be in the Assembly at any point in time. But it is important for us to be able to get back into the House to conduct the business of the province, to pass legislation that ultimately has been tabled, and to introduce and pass a provincial budget on behalf of the people that we collectively serve. A budget that will protect, build, and grow our great province of Saskatchewan, in particular as we navigate through the last number of weeks and couple of months of this pandemic. A budget that will grow Saskatchewan and ensure a strong economic recovery, ultimately, that will follow this pandemic. So I know members on both sides of the House are looking forward to getting back into the House, and I would just close with once again thanking all of the people in Saskatchewan for everything that they're doing and following the public health orders that are there. We're almost there. Keep it up for a few more weeks until we can all most certainly stick it to COVID and get vaccinated. Dr. Shahab, do you have some opening comments?
Thank you, Premier. So I'd like to first of all start with expressing my condolences to the families and friends of the 12 residents who have passed away since Thursday. And it's a reminder that the pandemic continues to be a difficult time for us, but certainly we are already seeing a lower number of outbreaks in long-term care residents, lower number of cases in 80 plus. So we're seeing the benefits of vaccination. And as the Premier said, as the vaccination program accelerates, we must step forward and get the vaccines as they become available for our age group. And if we are invited to participate earlier because of underlying risk factors. Yesterday, we received some updated guidance from NACI and AstraZeneca that currently it's recommended for use for people 55 and older and not for people under 55 till additional safety reviews are done based on some concerns from Europe about rare signals of blood clotting, primarily observed in women 20 to 55. While we are watching that closely, we have to recognize that we had a very successful program, a drive-through program of delivering AstraZeneca ultimately to primarily to individuals 58 and older in Regina, where we are seeing a current surge, and many people who were eligible in that age group, including myself, took that vaccine. And I have no doubts that as we speak today, AstraZeneca is protecting people in their 60s in the city of Regina who are at high risk of COVID because of the surge. So I think we need to be reassured that all vaccines, including AstraZeneca, remain very safe. We have not had any reports of adverse events as reported in Europe and Canada. But for those who have received AstraZeneca vaccine, if you have received it within the last 20 days, obviously, if you develop symptoms like shortness of breath, chest pain, leg swelling, abdominal pain, headaches or blurred vision or skin bruising, that could be due to a variety of conditions, but do mention that you did receive AstraZeneca in the last 20 days. So further investigations will be done to understand the cause of these rare events. And in many cases, they are not due to the vaccine, but that is just an additional caution for people who may have received the vaccine in the last 20 days. But generally, we will have AstraZeneca in small amounts available as supplies allow, and it will continue to be offered as required to people 55 and older, while the bulk of the vaccination program is going to be the mRNA vaccine, Pfizer and Moderna. But again, I'll repeat that all three vaccines remain safe and effective. Now, I just want to quickly mention that we are obviously very concerned with the case numbers in Regina and increasingly in other jurisdictions in Saskatchewan, for example, in Moose Jaw and in Weyburn, Estevan. And I would remind everyone that all of us should know where we live in Saskatchewan. All of us should be able to go to this detailed map on the website. We've had this, I think, all the way since July last year, but we must look at it, on a regular basis, at least once a week. So for all of us anywhere in Saskatchewan, all the general cautions remain. Maintain your household bubble small, up to 3 households, 10 people. Meet very cautiously. Meeting outdoors is better than indoors. Meeting while maintaining physical distance is better. Sharing food is still risky. Keep the smallest number of contacts you can. But then, of course, in Regina, like the Premier mentioned, we have high active case numbers. We are still seeing up to 100 cases a day, but thankfully, there's a lot of testing happening. The testing itself drives numbers up. Our test positivity actually is coming down. So there's some silver lining that all these measures in Regina are having an initial effect. They're nudging case numbers down, but we have to stay the course. And as the Premier said, if required, even more stringent measures could come into place. But we hope that with the current measures that are very stringent, the most stringent we've been in Regina since anywhere in Saskatchewan since March 2020, we hope things will turn around. But it takes everyone in Regina to comply. If you can work from home, work from home. Minimize the number of contacts. No mixing outside your household. Take out. You can't dine in. Curbside pickup as much as possible. And minimize your overall number of contacts and be very careful at work in maintaining your physical distance. And then if you are in Moose Jaw, you can see that 95 active cases, 10 new cases today for a population that's a quarter of the size of Regina. Again, very concerning, not at the level where Regina is, but certainly something that is concerning all of us. There's active discussions if further public health measures or orders are required for Moose Jaw, but certainly I support the mayor of Moose Jaw who has said that, behave as if you're in Regina, minimize the number of contacts, order more takeout, more curbside pickup, be very cautious about any household bubbles, and very cautious about any indoor gatherings. So I think Moose Jaw is on red alert, and this has to be watched very closely. And similarly in Weyburn and area, you can see that 26 active cases, Estevan and area 37 active cases. So there are many places in the south that are quite, concerning. Of course, some parts of the province are not so much so, but still we need to maintain our cautions to allow the very strong, very rapidly accelerating vaccine program to be successful over the next 6 to 8 weeks. And over the next 6 to 8 weeks, the bulk of the population, 50 and older, maybe even 40 and older, especially people with underlying risk factors, would have been vaccinated with at least one dose. And we will be in a very different place in 6 to 8 weeks. But we really need to stay the course for those 6 to 8 weeks. Thank you.
Thank you, Premier. Thank you, Dr. Shahab. We will now move to questions. We'll start here in the room. Lynn?
With the AstraZeneca now being recommended for only over 55, how does that impact our vaccine delivery plan going forward? And do you think this might raise some concerns, this back and forth recommendations about the vaccine for people that they won't get it now?
So I'll just a quick comment, and then Dr. Shahab, if you have anything to mention, but then Scott Livingston, maybe I just ask for a couple of comments on the impact of the 55 and over recommendation from NACI on the AstraZeneca vaccine, and what our vaccine distribution plan looks like over the course of the next few weeks. And then I think it will become clear to the people of Saskatchewan that this really doesn't impact where we are headed with providing Saskatchewan people with 180,000 vaccines over the course of the next 15 to 20 days, which is a lot of vaccines, virtually as much as we have received thus far. The changes that were recommended by NACI are different than what is recommended by Health Canada, and so we have these a little bit of variability in what is being recommended by two organizations here in Canada. Fortunately, in Saskatchewan, neither one of them impact what we were going to do with these, what was 45,000 vaccines. We understand now we'll have access to an additional 10 from India. We'll have about 55,000 AstraZeneca vaccines available to us over the course of the next 15 to 20 days. We're going to put those all through drive-through vaccination clinics in Regina, in Weyburn, in Moose Jaw, in Yorkton, in Saskatoon, to ensure that we make them available to Saskatchewan people as quickly as possible. And I would just say this on the vaccine that you were offered when it is your turn to be vaccinated, it will be safe. In Saskatchewan, all of the vaccines that we are offering to you will be safe for your age category, and your vaccinator will know your age category, and they will be safe for you. And Saskatchewan people can be assured of that. Dr. Shahab, if you had anything to add to that, and then Scott, just maybe explain a little bit about how we intend to get 180,000 vaccines out in 15 to 20 days.
Thanks, Premier. So, in terms of overall vaccine supply, AstraZeneca is a very small component, and the small amounts we get will be offered primarily as an additional program, as was in Regina, to persons 55 and over. And we have to remember that in the UK, they have vaccinated 50% of their population using both AstraZeneca and Pfizer, and have not seen the same concern so far that some countries in Europe have reported. Europe continues in many countries to use AstraZeneca, now 55 and older. And the signal in some countries was as rare as 1 in a million to 1 in 100,000, with in one country, Norway, 1 in 25,000. But again, even AstraZeneca at a global level remains a very safe and effective vaccine. And the small amounts that we get in Saskatchewan, like the Premier mentioned, would be used as an additional kind of booster for populations 55 and older, as was used in Regina. And we have to remember that despite the rare signal, in Regina, I have no doubt that just like other vaccines, AstraZeneca, along with mRNA vaccines, are right now saving lives in those who have been vaccinated in Regina. Now I'll hand over to Scott.
Thanks, Dr. Shahab. And just to go into a little detail about the vaccine capacity across the province, with or without the AstraZeneca doses, which are welcomed and will include us moving through the targets quicker. So we're welcoming those vaccines over and above our Pfizer Moderna allocations. Just to give you an idea of the capacity, the booking system has now booked over 157,000 appointments for Saskatchewan residents 62 plus to receive their vaccines over the next 3 weeks. We also today, as an example, this week, we plan to put 50,000 doses in people's arms in Saskatchewan, 9,500 today, weather permitting. And that's with less than about half of the vaccine clinics for the SHA open and operating today. So as we bring on more clinics, as vaccine arrives, and we also bring on community pharmacies and First Nations communities, our capacity will far exceed the ability of the federal government to supply us with vaccines. So when we do get these increased in allocations, we're already prepared to do that, and the teams are working hard on the ground. So in answer to your question, then one of the challenges with the AZ and some of the recommendations is just that the team has to pivot and rethink how we're going to administer those vaccines as quickly as possible, and they're doing that each and every time that those things change.
Thank you, Scott.
Follow-up, Lynn?
Yeah, switching over topics a little bit. Dr. Shahab just said that Moose Jaw is on red alert, basically. Why are we not bringing in new restrictions for Moose Jaw and other areas that are pretty concerning right now ahead of time when we've seen how bad Regina has gotten?
Dr. Shahab, do you want to go first, or you go first and then I'll follow?
Thanks. So I think on the one hand, we've seen throughout the last 13 months that when we put our backs into it, things turn around very quickly. And that, those voluntary adoption of additional measures has to be the mainstay. When there's a blizzard, highways aren't closed always, but travel is not recommended. And people who have to travel, but most stay home. And that's how you prevent harm to yourself and others. Same with, COVID. Communities in the south, and we should all go to the map and see what's happening. If you see case numbers go, you should be extra cautious, and that especially allows to our friends in Moose Jaw. And we have the one thing we have in Saskatchewan is space. We have so outdoors is better than indoors. Even when you're going shopping, businesses have done an excellent job of laying things out so that you can safely maintain your physical distance and get what you need. You can opt for curbside pickup, takeout. We must use all these options as much as possible throughout Saskatchewan. We have to use them in Regina. We should use them more rather than less in Moose Jaw. And in workplaces, again, many people can't work from home. They have to be at the place of work, whether it's manufacturing or industry. Even there, it is, workstations may be safe, but it's during break times, during carpooling that transmission has been happening. And again, we need to be extra diligent about those times when we are, taking a break, maintain that physical distance, don't share food or other items, and be diligent in using a mask whenever you're in common spaces at work. So I think that applies to everyone. It is under a specific order in Regina. People in Moose Jaw should really look at the Regina order and guidelines and try to emulate that. But like the Premier said, if the concern continues in Moose Jaw, further restrictions will unfortunately have to be applied, and similarly for other communities in the south of Saskatchewan. Thank you.
So I would just add to that, Moose Jaw, as Dr. Shahab also mentioned in his opening comments, is not yet at the level that Regina is at. And these decisions, in a large part are conducted to ensure that we can continue to preserve the capacity of our healthcare system province-wide. And province-wide, our healthcare system is managing the COVID situation that we have. But first and foremost, and I would reiterate what the Mayor of Moose Jaw had indicated here this morning in a press release, is that the folks in Moose Jaw, we would ask them to be very, very diligent with the public health measures that are in place. Not only the public health measures that are in place in Moose Jaw, but they should be paying attention to even going above and beyond those public health measures. In particular, for example, if you're someone that may be 50 or 55 or even 60 years old and has not yet received your vaccine, we need to be extremely diligent over the course of the next number of weeks across the province. In particular, I would say say we need to be even more diligent in Moose Jaw and throughout some communities throughout the southeast. The second point I would make is, and Scott had just spoken to the robust vaccination plan that we have, the vaccination plan that the Saskatchewan Health Authority and Ministry of Health have put together, that is leading the nation in making these vaccines available to Saskatchewan residents as we receive them from the federal government. We are going to be making a substantial amount of those vaccines available throughout the Moose Jaw, the Weyburn, the Regina area, Yorkton, areas where these variants are present, and that is most certainly our path through COVID, whether it's original COVID or one of the variants that are there, and ultimately as we move through the weeks, we will be dealing with predominantly variants everywhere in the province. Last, as Dr. Shahab said, as we look and discuss with the community of Moose Jaw and other communities ultimately, as needed, on an as-needed basis, there are options that we can move on. And we did that most recently this past week in Regina with restaurants and with worship services. That's not the goal. The goal is to not move on additional measures. The goal is to keep COVID at a level that it isn't overburdening our provincial healthcare system. We most certainly are in those active discussions as should we have to make some move in the days or in the weeks ahead with respect to Moose Jaw, but we're just not at that point here yet today. But we are at the point where, and Dr. Shahab had said this very well, we are at the point where we are asking those in Moose Jaw, those residents, to be just extremely diligent with ensuring they're following all of the public health guidance that Dr. Shahab has provided, and even go beyond that if they're able.
We'll take our next question on the phone line.
We have Stephanie Taylor with the Canadian Press.
Mr. Premier, why do you believe you can drive down the variant spread or the numbers in Regina, Moose Jaw, and other communities that are seeing surges without having to bring in additional public health measures? Like, what evidence do you have that will work?
Well, I think the thing that ultimately works with whether it's a variant or the original strain of COVID or any strain of COVID to this point, what actually works is vaccinations. That's why we are targeting many of the vaccines that we are receiving over the course of this week and next week into the areas of Moose Jaw, of Regina, of Weyburn, of Yorkton, places where the variants ultimately are present. I've always said that public health measures are nothing more than a stopgap to buy us time until such time that we get the majority of Saskatchewan residents vaccinated. We've always prioritized those vaccines where we have higher case numbers in the early days, and now where we have variant case numbers here today. And we are going to essentially double the amount of vaccines that are in people's arms in this province over the course of the next 15 to 20 days, receiving 180,000 vaccines. So that's the ultimate goal, is to provide the opportunity for folks in these communities to get vaccinated. What we are asking them to is there's significant measures in place in those communities today to be very, very diligent in following not only those measures, but people also have a choice to go beyond those measures, and we're asking them to consider that at this point. If we're not able to level the numbers, and as Dr. Shahab had said, in the case of Moose Jaw, they're not yet at the numbers where Regina is at. If we're not able to level those numbers in the next number of days, we will have to have a very serious conversation about potentially going forward, but we're not at that point today.
Follow-up, Steph?
Mr. Premier, the vaccination strategy to deal with these high case numbers doesn't make a lot of sense to me because, as you yourself have said, 80% of the active cases in Regina are people under the age of 50, and people under the age of 50 won't be able to get a shot for weeks, if not months, given the current schedule. So are you just does your government just want to avoid telling people what to do and closing businesses proactively? That's my question. Do you just at this point want to leave it up to people's personal responsibilities instead of your government telling them what they should do to prevent hospitalizations and serious illnesses?
I hope that there's no government in this nation or around the world that wants to close businesses or to limit the opportunity for people to go to work, people to go to recreational opportunities, or limit kids going to school. That's never the goal. It's never been this government's goal. We've never shied away from saying so. What we want to do is manage the infection rate of COVID. We have taken taken every step that has been necessary over the course of the last, what is approaching 13 months now, to ensure that we're preserving our healthcare capacity and preserving and balancing that with the opportunity for folks to carry on as normal of a life as ultimately as possible. The way through this is vaccines. The way through this is not to increase public health measures. We have significant public health measures in place. We're asking people to be extra diligent over the course of the next number of weeks as we find our way through the dying weeks, what we hope are the dying weeks of this pandemic, until we can provide them with access to a vaccine. To your question on younger folks being the larger number of people that do have COVID in most communities, quite likely across the province, but most particularly in Regina, I think that speaks to the fact also that vaccines are working. We do have our long-term care residents. Ultimately, all of them have one shot that have chosen to do so, and the vast majority now have had their second shot. And we aren't seeing outbreaks in our long-term care homes, most certainly not seeing outbreaks with our long-term care residents, because we have protected them by prioritizing our vaccines to them. We're doing that across the province now on an age-based criteria, moving to 60 years old to make appointments tomorrow. I believe when the drive-through closed a week ago in Regina, we were down to 57 and up, or it was 58 and up. We're accessing vaccines in that drive-through. We're going to pick up where we left off in Regina and add to that a significant quantity of vaccines available to the folks in and around the area of Moose Jaw, of Weyburn, or Yorkton, and going to ensure that as we receive these vaccines, we ultimately are going to make them available to the people of the province. That's our way through this pandemic. That's our way back to normal life, and we're going to do everything we can to ensure that Saskatchewan people have those vaccines sooner rather than later, so that we can lift these restrictions and ultimately not have to wear a mask everywhere where we go, not have to miss out on a Rough Rider game or an SJHL or WHL game, not have to not be able to visit our family in long-term care homes, our family ultimately on Easter, which is coming up this weekend.
Take our next question from Mark Smith with CTV.
With Regina or Moose Jaw being on a similar trajectory to Regina and just being slightly behind it, why not take the decision out of people's hands and not rely on them to be diligent and kind of take the decision out of their hands and put restrictions in place that would maybe stop that trajectory from reaching where Regina is?
No, very simple. We have faith in the people of this province. And the last item that we would choose is to enact restrictions that impact not only people's lives, but impact ultimately their livelihoods. So restrictions are not the first tool, and most certainly, and I don't believe they're the first tool for any government across this nation, nor should they be. People do have a personal responsibility to look at their own personal situation and to make their decisions accordingly, and we're asking them to, in particular, we'll do that across the province in these final weeks of this pandemic, but most importantly in the community of Moose Jaw, where we do have an increasing concentration of variants, not quite at the level that we are here in Regina at this point, but an increasing concentration of variants. We're asking people to be extra diligent in everything they do each and every day, so that if we are able, we will nip some of the increases that we are seeing in that community, and ultimately not have to go that extra mile to closing restaurants, putting people out of work, albeit for a temporary period of time. People have dealt with a lot over the course of the past year. We have many, many jobs that were here a year ago or just over a year ago that are not here today. We're going to make every effort to preserve the jobs that we do have today. And as we exit this pandemic, you're going to see efforts of this government to make every effort to not only recover all of the jobs that we lost, but to continue to get back to a growth agenda, growing our communities, growing our opportunity, growing our population, and growing that chance for the next generation to be successful in this province as well. We're doing everything we can to keep people safe today, but to answer your question, I continue to have faith in the people of this province, and I have faith in the people of Moose Jaw.
Follow-up question, Mark?
This may be for the SHA. What's the current capacity at Regina's hospitals, and what steps are being taken to ensure that the strain doesn't overload the hospitals here?
Scott, would you maybe be able to speak a little bit to the capacity in Regina, and then also a little bit of the provincial capacity we have in our provincial healthcare system?
Yeah. So we've talked lots about ICU capacity across the province in the last few weeks, and we know that typically we run with 75 ICU beds, but we have the ability to double that capacity province-wide. Last week we talked about the expansion in both the Regina General and Pasco ICUs. With respect to overall hospital capacity, I talked about last week that we are under significant pressure in Regina, not just because of COVID, but also non-COVID patients, and the fact that Regina General and Pasco Hospital are provincial facilities that serve all southern Saskatchewan. So since the beginning of the pandemic, we've had a defensive plan that looks at how we surge capacity when necessary, and we are still following that plan as we look at the capacity issues in Regina and southern Saskatchewan, how we build that capacity, but also utilize the strength of a provincial health authority and look at how we use capacity, not just for inpatient care, as we've transferred some lower acuity patients out of Regina to other facilities where they can be properly cared for and don't need tertiary services, but also in the other areas of COVID response, where we're looking at contact tracing and testing. We're expanding our testing, as you know, again in Regina tomorrow morning, and we are using contact tracing teams from across the province to follow up on positive and negative tests to support Regina through this surge.
We'll take a question on the phone.
We have Adam Hunter with CBC.
Premier, Regina is far and away the per capita leader in weekly cases across the country, and you said that the judge for putting in further restrictions would be getting to the numbers Regina's at. Why not act before then? Schools in Moose Jaw have gone to online learning. That's what precipitated Regina to go into more restrictions. And the health authority said the ICU capacity in Regina is at 115%. So I'm just wondering why, if you can explain to people why wait until numbers are at the worst rate in Canada before acting in a community like Moose Jaw, Weyburn, or Estimat.
I think what I said was the numbers are not where Regina's numbers were when we implemented additional restrictions in Regina, which included reducing our worship services size or keeping those at 30. Closing restaurants temporarily, and ultimately then the decision around closure of schools in Regina as well. What we're seeing in Moose Jaw is actually the closure of schools, so there is some movement that is happening for I believe a week or two before a week before the holiday and the Easter holiday, and then potentially a week after. I'm just not sure exactly on the dates, which is significant for those kids and families ultimately that do attend those schools, but it's also significant in just slowing down the interactions in and around the community of Moose Jaw as well. So there is some action that is being taken as well, as the government has been, and public health has been in conversation, and Ministry of Education have been in conversation with school boards across this province on the opportunities that we have to move to a level 4 or online or distance learning structure for, as in this case, much like Christmas, a week or two before the holiday, as well as a week or two after. So there are some measures that are being put into place. In saying that, the numbers in Moose Jaw are being watched very, very closely. Dr. Shahab had indicated that as well, and there are active discussions with the community as to where those numbers are going and what those numbers ultimately mean. But I would just come back to the path through this, and every week does start to matter as we have more people vaccinated in Saskatchewan today than we did yesterday. I think Scott had indicated the SHA has about 9,000 appointments in the queue for today. That means there's going to be 9,000 additional people that will be vaccinated in this province today, more than there was ultimately yesterday. We're going to receive over the next 2 weeks about 180,000 vaccines. We're going to make those available to folks, many folks in the community of Moose Jaw, that is going to continue to keep that community as well as Regina safe ultimately, and that is our ultimate path through this. So every week that if we look back in 20 days from where we are today, we'll be somewhere north of 300,000 vaccines provided to Saskatchewan residents, as opposed to where we are today at just over 100. I believe we're 188,000 actually when we include yesterday's numbers. So the vaccination program, day by day, more more people are being vaccinated. The discussions that public health, the government is having, Ministry of Education is having with the schools and with the community in general, and not just Moose Jaw, but other communities. We ultimately just aren't at that decision point here yet today, and it's my hope, I'll be very clear, it's my hope that we don't get to that decision point. It's my hope as we have continued access to vaccines in our communities that we do find a time when our numbers do start to bend. And in the meantime, we most certainly, as Dr. Shahab has mentioned, as I've mentioned a number of times already today, asking everyone in Saskatchewan to be just that little bit more diligent with our public health orders, be very, very diligent in what we're doing each and every day for the next number of weeks. We're so close to through this pandemic. Every time we get close, I know that it throws another curveball at us like these variants, but we can beat this. We can beat this, we can beat it together, and we will beat it together.
Follow up, Adam?
Mr. Premier, what's your message to people intending to gather over Easter? I know in different parts of the province there's different rules in place, but large gatherings are obviously discouraged and in some cases not allowed. What's your message to people that should they be staying home? Should they be not having communal meals? What's the best advice that you can give them before Easter weekend?
Well, I would ask Dr. Shahab for some specific advice with respect to if you are choosing to gather in more than one household, up to 3 households and 10 people in the vast majority of the province. But I would say if you're in the community of Regina, that shouldn't be happening. We'd ask for that not to be happening. That's where I will be this weekend. And in the community of Moose Jaw, I would also, and the southeast, I would just also urge folks to be very, very careful. If they are going to gather, I would urge them to consider potentially not gathering this weekend. We just have a few weeks to go, and we're going to be through this. Let's not have a bunch of spread of this variant just in the final few meters of the race. But for the vast majority of the province, I would say be very, very careful. Be very, very careful in what you're doing as we approach the holiday season. Be very careful with what your family is doing as we approach the holiday season. Dr. Shahab, do you have some specific advice with respect to if people are choosing to gather in multiple households, what tips and tricks you might provide?
Yeah, thanks, Premier. So obviously, extreme caution in Regina, and there's a public health order where you cannot gather beyond your household, except for some specific exceptions. And before this was put in place, we unfortunately have had situations where 2 or 3 households did gather under the previous guidelines, and even then, gathering indoors has resulted in transmission, in some cases hospitalization, even in ICU, of people in their 40s and 50s, so not people older. So and so now that situation is almost similar in Moose Jaw and some other communities in southern Saskatchewan. So extreme caution there. And again, outdoors is much, much safer. So the weather yesterday and today notwithstanding is getting better in the south. And so, meet and greet each other outdoors, spend time outdoors while maintaining that physical distance. But gathering indoors, especially in the south, I think is high risk. But throughout the province, I think families have been surprised when they've gathered and suddenly there's been a transmission event. And it's been especially sad for families when they gathered with the best of intentions and there were people 50 and older who then ended up being hospitalized. So I think, people are so close to getting vaccinated, a few weeks away from getting vaccinated. And, if the variants hadn't come into the picture, we would have been in a much stronger place. But unfortunately, Saskatchewan is not unique. In fact, Saskatchewan, apart from Regina, Moose Jaw, and a few communities in the south, overall numbers are low. And many other parts of Canada, there's a surge that is more broader. But I think, the variants did come. They are more transmissible. They cause more severe illness, especially in young people, while the elderly are now somewhat protected with vaccination. So again, I think this spring, this Easter again, is Easter to be cautious, careful, let people who are older than 50 get vaccinated. But even younger families, we need to be careful because the more community transmission there is, that puts everyone at risk. And I have to say that even with all the restrictions in place in Regina, essential services have to continue. And if we increase our community transmission, it puts everyone who have to work outside the home at risk. So we have to do what we can in terms of keeping our social contacts minimal, being extremely careful when out and about and at work. If we have to work outside the house to keep our numbers low, especially in Regina, Moose Jaw, other southern communities, but also throughout Saskatchewan. The lower our case numbers are, the more quickly and smoothly our vaccination programs will continue. Thank you.
Adam, everyone's situation is different as well, and if you take a couple of folks, elderly folks, one couple may be vaccinated, one may not, and they may come to a different decision on how they are going to celebrate the holiday weekend, depending on whether or not you have had access to a vaccine at this point or not, for whatever reason. And the other point I would raise, and Dr. Shahab raised it, is being outdoors versus indoors. The weather is supposed to be quite fine this weekend. If you're going to spend Easter together in areas of the province where that is allowed under the public health measures, I would encourage you to plan for an outdoor event. It is just much safer. We're in the final meters of this race of what is now the variants in the vaccines. We have substantial vaccines that are on their way. Let's not trip in the final steps of the race.
Take another question on the line.
We have Lisa Schick with CJME.
Hi. Mr. Premier, with this decision to not put restrictions on Moose Jaw, some people are accusing you of inaction, of being reactive and not proactive. What do you say to that?
Oh, people can, say what they like. So, as I say, as we walk through this last year, there are many folks that think that we have gone too far with restrictions. We see some of them, outside the legislature here from time to time. There are others that obviously think we haven't gone far enough. We have always taken the stance of protecting lives and livelihoods and ensuring that we are protecting the capacity that we have in our healthcare system. And, there will be many that will look at all of the different statistics when we find our way through COVID and compare them to other provinces, other states. And what I would say to Saskatchewan people right now is wherever you live, you have significant public health measures and recommendations that are apply to your community and ultimately apply to you and your family household. We would ask you to be very diligent in following those. And if you are in Southeast or in Moose Jaw, we would ask you just to go the extra mile and not even follow just the restrictions that are in place, but order takeout rather than going to the restaurant. Just be very, very diligent in even going a step further, so that we can nip this variant growth that we have in particular in Moose Jaw, but in a few other communities as well, until such time that we can have access to our vaccines. And vaccines are on the way, and we're making them available as quickly as we ultimately receive them. So there's a lot of opinions out there. I'm not going to comment on people's. They have the right to think what they like.
Follow up, Lisa?
Yes. Seeing as Regina's ICU is, over capacity, just wondering what the status of the field hospital is in Regina. Is that kind of up and ready to go if it's needed? And at what point does that start being used? Is it a number that'll set that off, or where does that go?
Scott, maybe I'd ask you again to speak to the ability of all of our ICU capacity, but in Regina in particular, the ability to flex that capacity up when needed, not only for COVID patients, but at any time. And then ultimately the provincial capacity that we have here in the province and can rely on when we see, in many cases, cases going down in virtually all regions of the province, save for Regina, Moose Jaw, and the southeast. And we see hospitalization steady to decreasing in other areas of the province as well. But a little bit on our provincial capacity, which I think will help Lisa with her question.
Sure. So Lisa, as I've already pointed out, we do have the ability to double the number of ICU beds across the system. We've already made a move to do some of that expansion in Regina to accommodate the patients requiring care from southern Saskatchewan. We will continue to watch and expand as we need to, but also, as the Premier has just mentioned, leverage the provincial capacity of the healthcare system to respond as it needs to respond, as we have throughout. With respect to the field hospitals, we will not be using field hospitals as ICUs. So from an ICU perspective, our plan for building ICU capacity for COVID and non-COVID patients is within our centers that have ICUs, and the upskilling of physicians, the purchasing of equipment and beds, and understanding what space will be triggered next is what will be the next phase of the plan, as well as looking at are there other options to increase our surge capacity, like reducing other non-COVID services, which are still available to us both in Regina and elsewhere in the province before we would activate the field hospitals.
I would just add to that, Lisa. The hope would be that our hope would be that our hospitalizations, even in Regina, are starting to ultimately levelize. We in all zones across the province, except for one, saw a reduction in our COVID cases here today. So the measures that are in place are working, and we're asking those folks in the southeast and in Moose Jaw and in Regina to be especially diligent with everything they do each and every day.
Take another question on the line.
We have Allison Bamford with Global.
Following up, I guess, on Lisa's question here. The last 5 days, Regina has had record high COVID hospitalizations. Given that hospitalizations lag behind new cases about 10 to 14 days, and our 7-day average right now is about 106 new cases, where are we expecting to be in the next 2 weeks or so, hospitalization and ICU-wise here in Regina?
Dr. Shahab, do you want to speak to that, understanding things are changing with age dynamics and, who is going into the hospital, ultimately who is, where COVID is being transmitted, and it's less and less in our elderly, in our long-term care homes, and increasingly in our more youthful population?
Yeah, thanks. So in terms of our general numbers, I think while our case numbers in Regina are at averaging around 100 per day, test positive per 7-day average was over 7 days is 37.9, went up to 50. Testing rates are extremely high, 450 tests per 100,000. That is an extremely high testing rate, which is fantastic. And we know that testing rates, when they're high, they generate more cases, but that's good because then you can successfully isolate cases and their contacts. Test positivity in Regina is actually coming down, 8.5 now. I think it went as high as 10%. So while Regina is concerning, there's some early signals that things may be turning around, but we do need to stay the course. And you're correct that even though we are thankfully not seeing high rates of hospitalization and deaths in 80 and older and long-term care residents, because for the most part they are well protected by vaccination and some protection for 70 and older, but the risk is still there for 50 and older. They do have a lower hospitalization and risk than 70 and older, but it's certainly not trivial. And even with the variants of concern, half of our hospitalizations and ICU admissions are in people who are younger than 50. And while in many cases they may not die, but by no means should we say that being hospitalized or being intubated is by any means something that we would want to happen to any of us. So I think everything is important. Having extra hospital capacity is critical, but we can't just rely on that. And while orders were required in Regina that are very specific, and if things were to not continue in a positive trend or not stabilize, it could become more stringent. We do know that it is ultimately to a large extent our individual actions at work, because many people have to be at essential workplaces, that even when orders are in place, those workplaces have to continue. But also in our social contacts, that we need to be very diligent during our social contacts at work, during break times, and at the household level, not just in Regina, but in Moose Jaw, all communities in the south, but I would say all communities throughout Saskatchewan, that while the rest of Saskatchewan is under still significant restrictions, but not as extreme as Regina, we know things can change rapidly within 2 to 3 weeks, as they did in Regina, as they are changing in Moose Jaw. concerning in Weyburn and Estevan, so things can change very rapidly. So that is why we need to be diligent about all these things for the next 6 to 8 weeks at least, and to get the opportunity for 50 and older, those younger with underlying risk factors, to be immunized. And then, of course, when our time comes, for those of us who are younger than that, do think of getting vaccinated as soon as you become eligible, because that will really, at a population level, provide the level of protection that will allow us to come out of at least the worst aspects of the pandemic by June. Thank you.
Follow-up, Allison?
Yeah, Mr. Premier, you've previously said that you had faith in the Regina people to make the right decisions to slow the spread of the variant, and then days later we were put into a regional partial shutdown. Now you're saying a similar thing to the Moose Jaw residents, having faith in them. Why should they have faith in your government that these recommendations are really going to slow the variants in Moose Jaw and not do the same thing that happened here in Regina?
Well, the same thing may happen that happened here in Regina. I'm not saying that we won't have to make a decision at some point, but I am saying, as per Dr. Shahab's comments earlier, that Moose Jaw is not at the stage where Regina is at this point in time. So you can't ignore facts when you're making decisions like this. You actually need to ensure that the facts, all of the facts, are coming into ultimately that decision-making process. And one of the facts that I think no one should ignore is the fact that we're going to receive in this province 180,000 vaccines over the course of the next 15 to 20 days, and we're going to make them available, all of those vaccines available to Saskatchewan residents. As Scott Livingston, the CEO of the Saskatchewan Health Authority, had laid out the plan that we have to get in excess of 10,000 vaccines being offered per day for 15 to 20 days in a row. This is a positive in our final few weeks of our battle, final few months, I suppose, of our battle with COVID-19 and finding our way through this. Many of those vaccines are targeted, yes, to areas where we have variants like Regina, like Moose Jaw, like Weyburn, like Yorkton, where those variants are present. And so we are asking the people, in particular of Moose Jaw, but throughout the southeast and Yorkton as well, and across the province, ultimately, just be very diligent in what you're doing. We may have to make a more serious decision with respect to restrictions in Moose Jaw in the days ahead. That should not be the first place that any government goes, is to restrict and ultimately send people home from work when they are making every effort to do so as safely as they possibly can. And it's certainly not this government's first position, but we may have to make that decision in the days ahead. We're going to do everything that we can, and I know that Moose Jaw folks will do everything they can to ensure that we aren't facing a decision like that. And one of the things that we can do is to have a very robust vaccination plan to make those vaccinations available as quickly as we receive them. We have that thanks to the hard work at the Saskatchewan Health Authority, and on behalf of the government, I'd like to thank each and every frontline healthcare worker that is working on the vaccination plan here in the province. I believe, Scott, you had mentioned it's a little over 4,000 folks across the province that are directly involved in that and in our vaccination plan, and for that I am forever grateful.
And we'll take our last question on the line.
We have Greg Wilson with Radio Canada.
Hello, I was wondering if the government had identified any super spreader event in Regina that would have accounted for the surge there.
Dr. Shahab, on that?
Yeah, so thankfully, because of the baseline restrictions that are in place throughout Saskatchewan since 14th December, and the only relaxation that's happened for the rest of the province is that with great care you can make household bubbles of up to 3, as long as you are conscious that people older than 50 may not have been fully vaccinated. Outdoors is better than indoors. And the rest of the province, with great caution, worship services have been expanded to up to 150 or 30%, whichever is less. But Regina, of course, is in significant restrictions right now. But because the earlier restrictions were in place since 14 December, we thankfully did not have super spreader events. And what happened in Regina was that workplaces which had good protocols that had kept them safe throughout the year were no longer keeping people safe with variants of concern, B117, because it is 70% more transmissible. So where otherwise an outbreak would have impacted 1 or 2 people out of 10 people at a workplace, 7 out of 10, 10 out of 10 were being impacted. And again, it was due to, in some cases, at break, just that closer than 2 meter distance, or people within an enclosed indoor environment for a prolonged period of time without good ventilation. So all these aspects are important. They become doubly important even in essential workplaces because we have variants of concern. And then, of course, ramping up testing and contact tracing is going to be critical. But again, we have not had any super spreader events in Regina. With the current orders in place, we hope that is not a likelihood. But I must say this is a caution for us throughout Saskatchewan, where we can, in some cases, have larger gatherings, either as a household bubble or in place of worship. Easter is very important, Passover, Ramadan, many important events are coming, the next few weeks for many faiths, and we all need to be cautious. I think protection of life is important than ritual. If you're vulnerable or have concerns, I think participating virtually has always been an option. Many faith leaders have supported and embraced that ability throughout the pandemic. I think where you're allowed to go up to 30 people in Regina, a higher number, still choosing to participate virtually will remain important for many people and should remain important this year, this Easter. And I think, especially for people who are close to being vaccinated, I think it would be unfortunate if, things that are not essential, getting surgery is essential, but things that are important, but things that we can participate in other ways is going to be critical this year, in my view. And we must all be thoughtful about that. And we should support each other to stay away. We should support each other to remain connected, but stay physically apart for the next few weeks. We've been saying that for a long time now, but for the next few months, we must support each other to stay apart and not force each other to come together. That puts our loved ones at risk, because there's always a lot of social pressure, whether you belong to a faith group or a family, to get together if it's allowed. And I think we need to just hold the course for the next few weeks. That would be my sincere plea for everyone in Saskatchewan. Thank you.
Do you have a follow-up question, Greg?
So you mentioned that it was it was oftentimes due to workplace outbreaks and with the B117 variant. If the numbers continue as they are, that they're usually similarly around 90 to 100, will there be more measures put in place that could target, for example, workplace venues?
Dr. Shahab?
So obviously there are still some venues where you can, for example, go to a gym. There's very little additional options beyond, non-essential retail. All of those sectors did close in March 2020. Even with the variants of concern, if we use all the options that businesses have provided, takeout, curbside pickup, going in a very systematic way for essential retail, I think that can see us through. But if required, additional measures may be required. But again, I think we have to protect also and recognize the sacrifice of people who have to be at work, who have to keep, fire, police, our power plants, energy companies, transport. These are the heroes along with the healthcare providers who have been at work each and every day. We need to stay home so that they can do their jobs. They need to be provided with the best masks and protections at work so that they can work safely and have the ability to have breaks in a manner that's safe. And of course, meeting outdoors is fine, but we need to resist the temptation to reach out to our loved ones in a way that puts them at risk. I think it's very, the pressure is great to reach out, but I think we need to stay the course, spend time outdoors as much as we can. But again, I think, and this is not unique to Saskatchewan. We have seen throughout Canada, throughout Europe, significant restrictions in place, and variants are still surging. And that's why it is really up to us to look at everything we do. What can we say, no, let's pause that and how can we keep people who have to be at work as safe as they can be. And that includes when we have to seek a service, whether it's from an essential work service provider, from a healthcare provider, we need to make sure that we are not seeking a service. If we're ill, we are calling ahead if we need to visit a healthcare facility. If we have symptoms that could be COVID, we're seeking testing in a safe manner, and we are using our best mask outdoors that protects us and protects others. Thank you.
I just add, Greg, to Dr. Shahab's answer around, there has been workplace outbreaks in Regina, across the province, across Canada. But there's been many workplaces that we should recognize that have been very, very safe throughout this pandemic. You think of the mining workplaces in this province. You think of the essential services that are being provided in our fire, our police officers. You think of our utility folks that are providing us with energy, power, our internet and cellular services. There was many SAS Power employees that were out working throughout that storm, ensuring that power was being restored to community after community as a storm took many power lines down. Where we were fortunate that they were not being impacted directly by COVID, so that they were available ultimately to provide that power service to our communities. Dr. Shahab also mentioned, as we enter into what is a number of holidays before us, whether it be Easter, whether it be Ramadan, whether it be the Passover. Now, where we can, we should participate in these events safely. In particular, and everyone's situation is going to be somewhat different, whether you've been vaccinated or not. But if there is an opportunity to participate, I hope would be this one last year to participate in this event virtually. I would hope that many would consider that this year. We're in the final number of weeks of what has been a very long year. Our vaccines are on their way. Let's ensure that we are being very diligent, as challenging as it is, and I'm as fatigued as anyone with the measures that have been in place. As challenging as it is, we need everyone just to come together for these last few weeks to ensure that we are keeping ourselves and our family safe until such time that we can provide this vaccine to everyone, and we're doing so as quickly as we possibly can. Thank you, everybody.
Thank you, everyone. That concludes today's availability.